Everyone, on behalf of NAT 24 by 7, I welcome you to our public awareness program, Current Perspective in Management of MASLD and MASH. NAT 24 by 7 Facebook page always aspire to bring best education and awareness program to serve healthcare professionals, patients, and their families. Today, we have renowned gastroenterologist from Delhi, Dr. Rishi Raman. He needs no introduction. However, I would fail my duty if I don't mention that. So, Dr. Rishi is a leading gastroenterologist and hepatologist, providing comprehensive care to many patients for various gastrointestinal and liver diseases. He has more than 6 years of experience in building clinical skill set that allows him to deliver patient-centric care. He is currently associated with Max Super Specialty Hospital, Patparganj, Delhi. So now I would like to invite Dr. Rishi to enlighten us on the topic current perspective in management of MASL and MASH. Over to you, sir.
Thank you, Mrs. Ketke. Um, are my slides visible?
Yes, yes, sir.
Yeah. So आज का टॉपिक है करंट पर्सपेक्टिव्स इन मैसल्ड और मैश. मैसल्ड मतलब मेटाबॉलिक एसोसिएटेड स्टीएटोटिक लिवर डिजीज. सो मेटाबॉलिज्म के रिलेटेड फैटी लिवर बेसिकली. सो ये सबसे पहले आई वुड लाइक टू थैंक Zydus for this great opportunity to enlighten our patients and future doctors, where they will be getting to know about steatotic liver disease, which is fatty liver. So, as everybody knows, that liver is the second largest organ of the human body, weighing about 1.5 kilograms with 5% fat. That is in normal circumstances. It is located in the upper right quadrant, that is portion of the abdominal cavity, and on top of the stomach and the intestines. On gross anatomy, it is pinkish brown in color, soft in consistency, and is highly vascular organ. तो ये इसमें काफी ब्लड फ्लो होता है. तो लिवर के कुछ फंक्शन होते हैं. सबसे पहला होता है पुराने आरबीसी, पुराने आपके ब्लड सेल्स को डिस्ट्रॉय करना, जो कि एज हो चुकी है जिनकी. दूसरी चीज, न्यूट्रिशन जो आ रहा है आपका, जो खा रहे हैं आप, उसको प्रोसेस करना. तीसरी चीज है इट रेगुलेट्स द ब्लड कॉम्पोजिशन, कि ब्लड में क्या पदार्थ रह रहे हैं, क्या टॉक्सिन्स. ब्रेक डाउन ऑफ अल्कोहल एंड मेडिकेशंस. ये सबसे ये सबसे ज्यादा कॉमन चीज है, अल्कोहल एंड मेडिकेशंस. बहुत कॉमनली देखा जाता है अल्कोहलिक लिवर डिजीज एंड मेडिकेशन इंड्यूस्ड लिवर डिजीज, बहुत देखा जाता है. तीसरा है इट produces proteins and cholesterol which is needed for our body's functioning. It detoxifies and produces bile, जिसको बोलते हैं पित्त. So coming to fatty liver, which is known as MASLD, it is a metabolic dysfunction associated fatty liver disease, and it is a condition which fat becomes more than 5% of the weight of the liver, and it is not caused by alcohol use. Associated steatohepatitis. हेपेटाइटिस मीनिंग इन्फ्लेमेशन हो गई, सूजन आ गई लिवर में. सबसे ज्यादा कॉमनली देखा गया है बीइंग ओवरवेट, ओबीस, हैविंग टाइप 2 डायबिटीज और हाई कोलेस्ट्रॉल. सो प्रेवलेंस ऑफ मैसल्ड, चार में से एक को मैसल्ड पाया गया है रिगार्डलेस ऑफ वेट, एंड मोर देन 6 people, more than 6 diabetics and 9 severely obese people out of 10 have MASLD. एक और स्टडी में यह पाया गया है कि मेल जेंडर हैज बीन रिगार्डेड एज अ रिस्क फैक्टर फॉर प्रोग्रेशन टू मैश एंड फाइब्रोसिस. So as you can see, progression of MASLD from a healthy pinkish liver, उसके ऊपर फैट की परत जम जाती है, कवरिंग अबाउट द ग्रॉस सरफेस एरिया ऑफ द लिवर. उसके बाद द फैट कॉजेज ऑक्सीडेशन, and causes fibrosis. Fibrosis is like puran jam jana. Scar tissue forms and causes more and more liver cell injury. जब इसकी स्कार टिश्यू की ज्यादा ही डैमेज हो जाता है लिवर पे, तो स्कार टिश्यू गोज इनटू सिरोसिस. The scar tissue destroys the liver cells. Liver is unable to work properly, and it causes shrinking of the size. That itself is known as cirrhosis. So there is a difference between MASLD and MASH. MASLD being only a liver disease, not having inflammation, while MASH is the hepatitis version of it, where there is fatty changes as well as inflammation of the liver. तो स्टीएटोसिस में सिर्फ फैट एक्यूमुलेट हो रहा है, और मैश में फैट एक्यूमुलेशन प्लस इन्फ्लेमेशन हो रही है और स्कारिंग हो रही है, एंड मे कॉज फाइब्रोसिस इन द एंड. So fat accumulation in the liver is also known as steatosis. Steatosis will lead to inflammation, जो मैंने बताया था सूजन, and it is known as metabolic dysfunction associated steatohepatitis. Scarring of the liver on benign stage, that is this third stage, is known as fibrosis. अब कारण, मैसल्ड के कई कारण हैं. सबसे पहला हमारा डे टू डे एक्टिविटी, सेडेंटरी लाइफस्टाइल, ओबेसिटी, बीइंग एक्सपोज टू सर्टेन मेडिकेशंस, और फूड इनटेक. जैसा आपने आजकल देखा है, जंक फूड काफी ज्यादा बढ़ गया है, एंड टू अ सर्टेन एक्सटेंट जेनेटिक बैकग्राउंड. So obesity and fatty liver disease, how does it cause MASH, which is now a global pandemic? Being overweight or obese causes fat to accumulate in the liver. This obesity increases the amount of fat to constitute about 10% of the fat over the liver. This leads to MASH and scarring of the liver. So association between MASLD and diabetes. Risk of death due to cirrhosis is due to this bidirectional flow. So there is high prevalence of diabetes in MASH patients and 2 to 4 fold increased risk of developing diabetes, vice versa. So symptoms of MASLD or MASH, they may be asymptomatic or symptomatic. If there are symptoms, first would be abdominal discomfort or pain, loss of appetite, nausea, and it may progress to jaundice. And later on, going towards cirrhosis and complications may cause confusion, trouble concentrating, and going into further, they will have weight loss, enlarged blood vessels, which is known as portal hypertension, enlarged spleen, red palms, and extreme fatigue. So these are the warning signs of impending liver failure. The diagnosis of MASLD. Fatty liver can be a silent killer because the progression of the disease is very gradual. The diagnosis of MASLD often involves the following. First, liver tests, which are blood tests. First, a routine LFT, then an ultrasound coupled with a fibroscan having liver stiffness measurement in kilopascals with cap values. Then, if needed, when the etiology is unclear, a liver biopsy may be needed. According to American Association of Study of Liver Diseases, a CT or an MRI triple phase is recommended to determine whether cirrhosis has undergone changes towards hepatocellular carcinoma. So the screening program has to be taken care of when a patient is being diagnosed as MASLD. So most common blood tests comprising of the LFT are SGPT, SGOT, or ALT, AST. So persistently elevated ALT can be associated with disease progression, and patients with normal ALT level can also develop progressive disease. So up to 80% of the patients of MASLD can have normal ALT, and there is no designated ALT cutoff for prediction of MASH or advanced fibrosis in MASLD patients. However, there was a study done in Italy where for females it was kept at 20 and for males it was kept at about 35. So using these blood tests, various scoring methods are established. Most commonly used in our practice is FIB4, that is comprising age, AST, ALT, and platelet. The other score is NAFLD fibrosis score, where age, AST, ALT, platelet counts, BMI of the patient, fasting blood glucose, and albumin is taken care of. And these scoring methods have been established to diagnose more better than the ALT to AST ratio alone. Online tools are also available to calculate these scores, such as MD Calc. So, right now, which is being popularly used, non-invasive testing for MASLD. First and foremost is the ultrasound, where you can see the normal. This is the normal echo texture of a liver, smooth, no scarring. Fatty, there will be what is bright red. This will be a bright, not brighter, brightness of the liver would be seen, and in cirrhotic there would be shrinking of the liver size, and there would be a coarsened echo texture. If you compare with this, this is a smooth echo texture. In this, there is coarsening of the echo texture. So this is the first and foremost modality available to diagnose MASLD, and it is easily available, economic, and reason for most accidental diagnosis of MASLD. But there are some drawbacks to it. It only detects MASLD if the fat is more than 25% and cannot differentiate between fat and fibrosis. So the other non-invasive diagnosis includes a transient elastography, known popularly as fibroscan. So to diagnose MASLD with fat more than 10%, a fibroscan is indeed needed. It is used for differentiating between fibrosis and fat content. It is easy to operate, and it can be misinterpreted in obese patients. Thus, we have an Excel probe for these patients. So transient elastography, as you can see in this slide, this is the machine having this probe. This is the machine and this probe. So liver scan works on the principle of transient elastography, and we get two different values from this, including liver stiffness measurement. LSM indicates the degree of fibrosis in the liver, and CAP, that is the controlled attenuation parameter. It indicates the degree of steatosis in the liver. So other non-invasive investigations include MRI elastography, where it is the gold standard to detect fat content. It can measure fat content of more than 1% and is widely used technique for liver donor patients. Now, the earlier gold standard, that was the liver biopsy, which has been replaced by non-invasive tests. It remains when a patient comes to us with fatty liver. If the etiology is known, we don't proceed with the liver biopsy. If the etiology is still in doubt, a liver biopsy is recommended. And it is the gold standard method for diagnosing MASLD, only method to diagnose MASH and rule out other liver diseases. But it is an invasive test. It requires admission, and it is painful, individual dependent, and chances of misdiagnosis in early stages of MASLD remain. So, a diagnosis of MASLD may progress to MASH, then MASH cirrhosis, and further it can decompensate or straight away go towards hepatocellular carcinoma. MASLD can also have an isolated fatty liver or fatty liver with mild inflammation and may progress to MASH. So, thus, we have to act before it's too late. Metabolic dysfunction associated with steatohepatitis is more serious form of MASLD in which you have scarring of the liver, and MASH may lead to cirrhosis or liver cancer. And one point is severe MASH is not reversible. And progression of MASH can also increase the risk of heart related disease, which is coronary artery disease. Treatment includes diet modification, exercise, lifestyle modification, and certain new medications have come into the market. And it requires, first and foremost, a consultation with at least a gastroenterologist or a hepatologist. So control your weight gain. Combination of hypocaloric diet, moderate intensity exercises provide best likelihood of sustained weight loss. A weight loss of at least 3 to 5% of the body weight helps to improve this steatosis, and weight loss of up 7 to 10% to improve majority of histopathological features of MASH, including fibrosis. The weight loss effect on MASLD, first of all, if weight loss is about more than 3% steatosis, if weight loss is more than 5, if ballooning inflammation is there, then weight loss recommended is about more than 5%. If NASH resolution and fibrosis, so at least 7 to 10% is needed. So diet for healthy liver. It is a difficult task, but if followed, it gives good results. So moderate portions of poultry, eggs, cheese, and yogurt are allowed. But red meat and sweets should be avoided. Everyday meals include more of vegetables, fruits, whole wheat, grains, olive oil, beans, nuts, legumes, and seeds and herbs and spices. Fish and seafood may or may not be required, but if you're a vegetarian, I recommend not to have. So types of exercises, aerobic and resistance exercises, which many of us do in our local gyms. So aerobic exercises are the best. They reduce the liver fat, they maintain healthy weight, and improves the cardiovascular functioning. While the resistance exercise, they improve the glucose absorption and insulin sensitivity, thus reducing the liver inflammation and improve metabolic parameters with less energy consumption. So lifestyle tips to tackle MASLD or MASH. Get enough vitamins and minerals, regular medical checkups, small meals but frequently. Sleep is a very big factor nowadays, and develop an exercise routine and stick to it. Lower the processed food and sugar intake. So pharmacological approach. Previously, we had vitamin E, pioglitazone. Recently, about 5 to 7 years back, saroglitazar had come, which was showing great results. And saroglitazar is known as Bilepsa. So NASH with or without fibrosis in both diabetic and non-diabetic patients are being treated. And suggested minimum duration, according to the INASL, is 1 year. So tips to prevent fatty liver disease. First is limit intake of saturated fats, quit smoking, obviously, exercise regularly, limit or avoid alcohol, take medications as prescribed by the consulting gastroenterologist and hepatologist, limit the consumptions of refined carbohydrates, and maintain a healthy weight. There should not be a weight gain, but about 3 to 5% of the estimated weight loss should be done. Thank you.
Thank you, sir, for this wonderful talk. This has entertained us. Now, sir, with your permission, we will take few questions that we received from our audience. Shall we, sir?
Yeah, please.
Yes. Sir, how common is MASLD and MASH in Indian population?
About 50 to 60% of the North Indian population, according to PJ Chandigarh, there was a data. 50 to 60% are suffering from fatty liver. That is MASLD.
Okay. And sir, can we say MASH is a age-specific disease?
It's not an age specific disease, but yeah, nowadays it's an about into the fourth and fifth decade, we are seeing more and more patients.
What type of food to avoid in MSLD patients?
What type of?
Food to avoid in MASLD.
See, first of all, if you're a vegetarian, processed food, fried food, a lot of junk food people are eating, so they should be avoided. And sweets. The main culprits are fried and sweets. Fried foods, sweets, processed foods. These are the main culprits which we are seeing nowadays, and many people are eating because of the availability at home at odd hours.
So, what is the ideal exercise recommendation for MASLD patient?
See, for a patient who is just starting and just diagnosed with MASLD, I would recommend him 45 minutes of brisk walking per day. That is, brisk walking is a little less than a jogging, but at a brisk pace, you have to walk at least 45 minutes per day.
Half of Nance 24 by 7, I extend my sincere thanks to Dr. Rishi for enlightening and engaging talk on MASLD. Sir's insight have highlighted the need for increasing awareness about fatty liver disease. I also want to express my thanks to our audience for their participation. Please stay connected with Nash 24 by 7 on Facebook page for upcoming updates and information. Take care, stay well. Thank you. Thank you so much, sir, for joining us.
Thank you.